Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi everybody, welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency right here servicing Palm Beach County, Broward, and Miami-Dade, and you can reach us directly at 954-717-7027. I am your host, Louise Gomez. Welcome to the show. And today we have Dr. Simone Van-Horne. And Dr. Van-Horne is right here in Pompano Beach. The address is 2701 North Course Drive, Suite 125, Pompano Beach, Florida, 33069. And the office number is 954-470-2851. Website is vipobservation.com. Thank you so much for joining us on the show, Dr. Van-Horne.
Thank you for having me.
I'm very excited to learn all about what you do. So can you tell us a little bit about your background and your experience, and tell our viewers a little bit more about your education so we can learn about you?
Okay. So I am an internal medicine physician. Okay. I grew up in Jamaica. I went to the University of the West Indies. I initially did medical school in Trinidad, and then I went to Jamaica and I did my internship there. Mm-hmm. And then I wanted to come to the States, and I went to Bermuda for a little while, did all of the tests that you have to do to come over here to the United States.
Sure.
But I did that from Bermuda because it's first of all, you make U.S. money in Bermuda,
right?
And then it was kind of closer just to like hop over there to go to all the different interviews. Anyway, I then went to Philadelphia, which I love Florida, but I think Philadelphia is my favorite state.
Good for you. Okay.
And I did my residency there. I redid my internship and my residency there.
Okay.
And in internal medicine at the Pennsylvania Hospital, which is the nation's first hospital.
Yes.
In the University of Pennsylvania Health System. And that's what I really loved about Philadelphia was the history and the art and the city life, and it was just a nice mix of everything. So I was in Philadelphia for a while, and I did internal medicine. I also did an HIV specialization while I was there. I had a strong interest in HIV, which was huge at the time. Still huge.
Yes.
But
what year was that? So that was going back a while. So that was
2006 is when I finished.
Yeah.
And at that time, the protease inhibitors were just coming on the market. It had just been discovered, and so that was huge.
Yeah.
And then I went to Trinidad for a little while, and I tried to work in HIV, and I did some hospice work, and then I decided I wanted to come back to the States, and so I lived in this little town called Watertown, New York.
Oh, upstate New York. Real cold over there. Yes.
Super cold. And so super cold that after they had the Arctic frost, I don't know if you remember, they had this Arctic frosting where even the Niagara Falls got frozen.
Yeah, I believe it.
And I was like, that's it, no way.
Yeah.
And I pelleted for Florida, and then here I am.
Well, we're so happy to have you here. We're so happy that Arctic weather brought you down south.
Yes.
So, Dr. Van-Horne, what is the age range of the patients that you're treating now? Can you give us a little bit of a better, broader picture of what what your patients you're seeing?
Yes, so my patients are adult. I don't see pediatrics. 17, 18 maybe, where I begin
Right.
seeing patients. And I go up until, as I said, I still do hospice. I'm a medical director as well for a hospice company called ProMedica. And so
Oh, wow.
I do it all. I
Yeah.
do you in good health, and I do care when you're in bad. And most of the hospice care, although it's for the patient, is really for the ones who are left behind.
I like how you put that because
Yeah.
that's so true.
Yeah.
It just shifts the perspective because it really is for us who are staying here and what do we do. So thank you for sharing that information. So, Dr. Van-Horne, do we need a referral to see you, or how does that work, or just you take regular insurance?
Yes, you don't need a referral to see
Okay.
me. I'm a internal medicine, so internal medicine or family practice or general practice, however
Okay.
people want to think about that. I do take cash and I do take insurances.
Okay.
In terms of insurances, right now we're set up to do Aetna, TRICARE, Cigna, Medicare, and Blue Cross Blue Shield. That's where we are right now. We're working on some others. But yeah, no, you don't need a referral at all to see me.
Good.
Yeah.
And so I know you have extended hours because I think you're open Saturday. Can you tell us a little bit more about your hours? And thank
So
you.
yes, we do Monday to Friday, and on Saturday we are open. Very shortly, we're also going to have a nurse practitioner on our team who's going to be doing gynae, and she's going to do the gynae
Nice.
on a Saturday only.
Okay.
That way, women who are doing their hustle and bustle can get
Yeah.
in. And I do one Sunday a month, and that started really for my colleagues as physicians, because we are so busy during the week.
Wow.
And for nurses, sometimes they can't get in during the week and with the traffic and whatever. So I've started a Sunday thing, which began for them, but the odd patient will want to come in as well.
Well, thank you for thinking about that because we're so concerned about us, but wait a minute, the
Yeah.
doctors, the nurses, the nurse
Yeah.
practitioners, you need your
Yes,
you
yes,
need
'cause
it.
we're attending to people Monday to Friday. We have
course.
office hours, and there's nobody to tend to us
That's
after.
right.
And so, yeah.
Yeah. So, Dr. Van-Horne, we were discussing prior to the interview a little bit about what are your areas of interest, and I know you're very passionate about everything you do, but can you tell us a little bit more about what your areas of interest are?
Yes, so I do internal medicine, and my major area of interest is anti-aging, like how to make this aging process as graceful as possible.
Yeah.
And I guess it's kind of near and dear to my heart because I'm aging, like we're all aging.
Sure.
But I started going through menopause, and when I started going through menopause, I really wanted to know what's the evidence out there for what I'm going through and what can I do to make it easier. And for my patients at the Court of Palmyra, which is where my office is located, we're in the on the ground floor of that building. I'm seeing my patients go through a lot in the aging process: incontinence and fatigue and
Right.
cognitive stuff. And so all of that, although it's always been my interest as an internist, I then became more aware of the hormonal aspects that contribute to the aging process, and that really kind of revolutionized my approach to healthcare and my knowledge base in general.
Well, for me, bioidentical hormones have changed my life personally for the past 7 years. And if it was not for bioidentical hormones, my life would be drastically different. And most people are afraid, they're not aware, they're not educated. I think I told you I had these migraine headaches that were I couldn't get rid of them until I went to a doctor who knew, okay, we got to get you, check your blood, check your, your hormones. Oh, you're low on progesterone. Okay, boom. No more migraine headaches.
Right.
Another doctor had to put me on migraine medication, right? So, this changed my life tremendously. What results have you seen, or what can you tell us about other people that say, you know what, Dr. Van-Horne, I'm going to take your advice. I'm going to do the bioidenticals. So if you can maybe tell us a little bit more about the bioidenticals and what stories, what good things.
So when I went through, this journey as a doctor, like just kind of thinking about, hormones, I was just kind of thinking of myself really, and menopause and women.
Right, right.
Right. And to be honest, it was a friend who really kind of opened my eyes. She was doing bioidentical hormones, and she came to me with her lab results, and she said, can you take a look at my lab results and tell me if everything's okay? And so I was like, why are you replacing testosterone? Like, you have a testosterone problem. And she's like, I don't know, but I feel amazing, right? My sex life is great. My joint pains are gone.
Right.
And my menopause and my hot flashes are gone. So I don't know what they're doing. I think you should just call the rep and find out what they're doing. Because for me, it was like, what is the evidence for this replacement? Because to be honest, where I left off in residency and in training, and where most doctors really are, like our standard of thinking is, there's a Women Health Initiative study that was done in the, I want to say 1980s. Yep. And that used hormones, but it was hormones that are synthetic, right? And so they had really bad outcomes with the synthetic hormones. They had women who developed breast cancer, they had strokes. And so what basically happened is women who were on hormones at that time were told to get rid of the hormones. Hormones are bad. Hormones are evil. And that's kind of the takeaway home point that I took from residency. Like, don't go near hormones, don't touch it. It's just too much.
They scared all of us.
Right. But the Women's Health Initiative study did have some good points in it, and those good points were never elaborated on, or rather they were elaborated on, but they were just not elaborated on in the United States. In the UK and Europe and in Australia, physicians there did go the extra mile, did do the studies, and they did the studies with bioidentical hormones as opposed to the synthetic hormones.
Right.
And they've been using this approach to medicine ever since, right? And it's just now kind of making a loop back to the United States, I would say in the last 15 years. I'm kind of late to the game, to be honest. But the bioidentical hormones are a completely different animal. It's like chalk and cheese. They're not the same. And what confuses people is that they will say testosterone, but they won't say what exact testosterone they're talking about. So anabolic steroids that weightlifters use and that our athletes are using to juice up is not testosterone that we use for bioidentical hormones.
I'm loving this conversation. We're going to be back. We're going to take a quick commercial break, and we're going to continue because it's getting really good. And I'm learning a lot. So we'll be back, and keep that thought, anabolic steroids. Thank you. We'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thanks for tuning back in to our show, You and Your Doctor. I am so intrigued. We have Dr. Simone Van-Horne right here at 2701 North Course Drive, Suite 125, Pompano Beach, Florida, 33069. Phone number is 954-470-2851, and the website is vipobservation.com. Thanks for holding that thought, Dr. Van-Horne.
Yes.
So we were talking about that tragic study that really infiltrated all the doctors here in the United States.
Yes.
And it was like curtailed everything and everybody stopped. And so now you're saying...
We have way more studies. We have way
Yes.
more studies. A lot of studies out of Europe, a lot of studies out of Australia. But now more studies are being done here.
Nice.
And we're really seeing that your synthetic hormone, though it gets in, I like to use this analogy, you know, a hormone with a cell is like a lock and key,
Yep.
right? Mm-hmm. So with your synthetic hormones, you can get the key in and it will turn the lock like kind of jagged, like when you're trying to use another key to like try to turn the lock. And it may get around, you may get the door open, but it's not a smooth process. So in come your adverse effects, like so if you're using testosterone, in comes the heart attacks, in comes like the impotence, in comes the strokes that we've seen.
Yeah.
We've all seen all these athletes like just drop dead, right? And that drop dead phenomenon, people will broad brush it and say like it's testosterone. But that's a pharmaceutical drug, and that's not bioidentical hormones.
Right.
Completely different thing. So testosterone, which is bioidentical, will actually do a couple of things different. It actually will boost cardiovascular health. It dilates your arteries, so your blood pressure falls. Testosterone also increases your insulin sensitivity. So you may find that as you lose weight, you actually may stop requiring diabetic medicine.
Right.
So as that's just three things. Testosterone builds your bone.
Right.
It increases your blood count. So those are two completely different animals. One is going to give you, both of them are going to give you big muscles.
Right.
But one's going to give you a lot of side effects and put you at risk of death. And the other one is actually going to decrease your mortality. Same thing with estrogen. Estrogen is opposed to like, you know, the synthetic stuff that they have.
Right.
And even, so Premarin, right?
So is that a synthetic?
That's the synthetic, that's a brand name.
That's the brand name.
A lot of women take Premarin. Premarin is progesterone from a mare. Premarin. Progesterone from the mare.
Right.
It's progesterone that comes from horse urine.
Right.
It's like our progesterone, but it's not bioidentical at all.
So can you please explain to the audience how is the bioidentical? What is it made from? Mm-hmm. And how does it come? I know I have a cream. Everybody has a different. Right. So what is it made from?
So your bioidentical hormones, or rather the ones that I use, the most identical hormone or molecule rather to us. It comes from soy and yam.
Right.
And so that molecule is what is used to make the hormones, right? And it has a lock and key effect, right? It's very, very smooth process, and you want to make sure that you do get with a physician who's using compounded compounded hormones that are going to be released properly. Not all of them are created equally.
Right.
So you want to make sure you use a good form.
So, like for example, I use a cream. It's specially formulated to me, to what I need. It's exactly what my body needs, and I get tested every 3-6 months. They test my saliva or my blood. So I know there are different forms. Like there's the pellet. Some people opt to have the pellet. I chose not to. Can you tell? Do you do the pellet?
So the pellet is what I do.
Oh, nice.
Yeah,
Tell
pellet
us.
is what I do primarily. So the pellet, the great thing about the pellet is that you don't have to think about applying anything. You don't have to do anything. Once it's in, so it's for people who are non-compliant, it's amazing because you do the procedure, you put it basically in your fat, and capillaries grow around that pellet. And then depending on what your cardiac output is what you absorb.
Wow,
So
that's amazing.
if you have a really bad day at work, or you have like a fight, or you have to run a marathon, you're going to absorb more hormones from that pellet. So it mimics basically your physiology, right?
It's amazing.
So when you need more hormones, like but like say before you got to menopause or andropause, then your body would secrete more hormones. So absorbing it from the pellets mimics that process.
That's amazing.
Right? And so that's what I do. Progesterone, though, has to be taken as a tablet. There's no progesterone pellet.
I take that at night, and I take the pill at night, and then I do the cream in the morning. It's changed my life tremendously.
Yes. I mean, the somatic things in terms of like how you feel and that's amazing. But for other physicians, which is kind of where my main passion lies, because we don't know like all of these studies, is that it's major. I mean, people's blood counts are going up with testosterone. Testosterone has been shown to do way better than antidepressants in terms of changing people's mood.
There you go.
They have an 87% success rate. Antidepressants have a 60-something% success rate. In terms of even like bone turnover, testosterone and estrogen, if you use them together, that basically mimics what your bone would have been when you were in your 20s and 30s. The medicines that we have now does not cause that density of the bone, right? It's not the same, right? So balancing your hormones, or what I like to say, like kind of optimizing them as much as we can, really gets you back to where you were in your 20s and 30s in terms of how you feel, how your body feels. There's still, wear and tear on this machine, right? So you're not going to be exactly the same as you were in your 20s and 30s, but you're going to feel dramatically different, mood-wise, and just in terms of like how your body physiology is going to be working.
Absolutely. So now a lot of people are listening and they're thinking, oh, that's for women only. Why would I balance I mean, that's a woman problem. So what would you say to these men who are listening? What advice? We have 5 minutes, so maybe you could speak into that about men and
men want to think it's like all about the woman, but you guys go through andropause. At age 30, men's testosterone is decreasing by 1 to 1.5% every single year. So by age 40, we can, the things are beginning to happen. Your mood is getting more irritable. You're getting more obese around the abdomen. Those are all a function of testosterone decrease. And your sensitivity to insulin is decreasing. So here comes your hemoglobin A1C kind of creeping up. You're not sleeping well. Testosterone is our mood hormone, which is why men tend to be calmer in general, just generally, right? But men become more anxious, they become more irritable, kind of like their wives are, and that's where all the arguments start, because both of them are losing their hormones, right?
Right. So we have 1 minute left. What are you going to tell everybody? What's the message you want to tell everybody in that 1 minute?
The message is, when you have like symptoms of anxiety and irritability, you're feeling exceedingly exhausted, like you can never get enough rest, exhausted.
Yeah.
That's not normal.
Right.
You need to check your hormones. You need to find a doctor who knows about these hormones, and you need to find somebody that you can trust, right? And have a very open and frank conversation with your physician. If your physician doesn't do it, just find someone who does the hormones. You don't have to leave your primary care doctor. You could find somebody who does hormones, understands that, and keep your doctor.
Good note to end on. So, you can see Dr. Van-Horne, and like she said, you don't have to necessarily leave your primary care. And again, I'm going to leave you with her number, because you're definitely going to want to reach out. 954-470-2851. Thank you so much for tuning in. Have a great rest of your week, everyone.
Thank you for letting us share with